Go.
Hello everyone, and thank you once again for joining us on this streaming event. My name is Mike Brooks. I'm the Vice Chairman of the Sullivan County Legislature, and on behalf of all the legislators, I thank you for joining us. Hopefully you'll find this session as informative as the others. We've been getting some great feedback. Continue to send those questions to us, please. Our Chairman, Rob Doherty, extended an invite to our BOCES Superintendent, Robert DeVore, and he joins us today. So, Robert DeVore is here. We have our County Manager, Josh Tosek, here. And also via Skype, we have our Public Health Director, Nancy McGraw. Now, before we get started, I'm just going to share a couple items with you that just underscores the importance of and long-lasting effects of what this COVID-19 pandemic has posed to not just our county, but the state. And this information came from the New York State Association of Counties, and some stats here which I find sobering, and I want to share that with the residents of the county. In January of this year, Governor Cuomo projected a $6 billion deficit, that's with a B, billion-dollar deficit, as part of his $178 billion proposal. As a result of the coronavirus pandemic, New York State revenue is projected to drop between 9 and 15 billion. The Senate and Assembly has given Governor Cuomo unilateral discretion to reduce spending quarterly if revenues don't meet targets. The New York State Association of Counties has estimated that if the state were to see a loss of 15 billion, then counties and school districts could see state aid cut by 15% across the board. That would equate to a reduction of $4 million in state aid to our county. Imagine the effects of that. Now, Sullivan County receives approximately $200,000 to $250,000 per month in the form of casino impact revenue. That's just one business here. With the casino being closed and collecting no revenue, we won't be impacted by this amount or lack thereof each month. Like I said, I'm trying to share with people what we're seeing and what we are worried about here in the county. For Sullivan County, the New York State Association of Counties estimates a sales tax loss of between 1.85 and 5.63 million, depending on the duration of the pandemic. Additionally, New York State has authorized the creation of a hospitalization stabilization fund to help distressed hospitals and nursing homes across the state. This fund, in part, will be supported by the state intercepting county sales tax collections. Intercepting sales tax collections. This will be a $50 million impact to upstate community or counties. We are waiting and still assessing to see in more clearer terms what this will eventually mean to Sullivan County. Of course, a lot of that depends on the length of this healthcare crisis. So with that, I'm going to throw that over, or throw this over to Bob DeVore. Once again, he is our BOCES Superintendent here in Sullivan County. And Bob is going to share with us any information regarding the public school system here in Sullivan County that he deems appropriate. This is for information that we wanted to bring to the residents of Sullivan County as far as our school system. So Bob, it's all yours.
Thank you, Mike. Just a couple of items. While we were sitting here before the broadcast started today, the Times-Herald Record reported that during the governor's briefing this morning, he did announce that schools will remain closed through April 29th. The Board of Regents is meeting up in Albany at this time for their monthly meeting, and it was also announced earlier this morning that Chancellor Rosa has announced that Regents exams will be canceled. Guidance will be coming out from the State Education Department either later on today or tomorrow. School budget votes have been postponed until sometime after June 1st. Those will be scheduled based on guidance from the State Education Department. Based on what Mike was saying earlier, school districts are anticipating a substantial loss in school aid this year based on the budget projections that are coming out of the executive office. Many school districts are holding back in finalizing their budgets until after the first look-back period, which is set to run from April 1st to April 30th. This is where they will get an idea of just how much their aid reductions will be impacted. So a lot of information on school budgets will be held up pending these revisions. So you can anticipate seeing information coming out from your schools probably sometime after April 30th. School districts around the state have been charged by the State Education Department and the executive with three primary missions while we are closed. First and foremost is childcare for essential workers. This is first responders and other workers that are essential to the operating of our communities during such time while schools are closed. The school districts of Sullivan County have worked together and are running a joint centralized childcare operation out of the RISE building at Catskill Regional Medical Center. Catskill Regional is proven to be a sound and reliable partner not only for the health care in this community but also addressing other needs. We have a handful of students there from various workers throughout the county. If you need information on childcare and you are an essential worker, you can go to the website of either Sullivan BOCES or your local school district, and it will provide all of the information about how you can drop your child in and get childcare while you're at work. The other thing that our school districts have been charged with is child nutrition. There was a grave concern that with schools closed, many of our children rely on those meals that they get at school. So we've been charged by the State Education Department to assure that we do everything conceivable to make sure that that food gets into the hand of those children that need it most. I'm pleased to say in the past 3 weeks, just in the communities of Monticello, Fallsburg, Liberty, and through Sullivan BOCES, over 43,000 meals have been distributed to children and families in need. The final thing that the school districts have been charged with is continuity of instruction. Each of our school districts are working to move their instruction to online platforms such as Google Classroom. And for those students that do not have a reliable internet connection, many of our districts are working with Verizon and Spectrum to pop up mobile hotspots to give them access. Chromebooks are being sent home so the students can access instruction, and those students that have no access to internet whatsoever, packets are being sent or mailed home to those individuals so that they can continue with their work. Students are being contacted by their teachers by phone and also through various online platforms, including Google Hangouts, where teachers are meeting with their students and trying to keep them up and current with their work. Medical supplies have been donated by all of the school districts in the county to Catskill Regional Medical Center. Our nurse's office and our medical suite at CRMC were all cleaned out, and all of those supplies were donated in our effort to help the hospital. Our medical suite, which is located on the 5th floor for our health occupations class, was turned over to the hospital as of last Monday and is now an ICU unit treating COVID-19 patients. That all of our school districts had to make needed supplies for the hospital. A member of the BOCES staff and her husband, working with SUNY New Paltz, delivered 100 face shields to Catskill Regional just this morning. So our school districts throughout the county, even though our buildings are closed, are providing much needed and valuable services, not only to the students, but to the family of our children and to essential workers throughout the county. If you ever have any questions concerning your school district or the services being provided, you can contact me through the Sullivan County BOCES website. My direct number is 845-295-4015 or robert.dufour@scboces.org. Thank you.
Thank you, Robert. Thank you for joining us. That was a lot of information and quite valuable information. Thank you once again. Now, our first question is going to go to Nancy. What are the latest figures, confirmed cases, people currently hospitalized, people currently recovered, people who have died, and how many tested?
Good afternoon. As you can see from our updated dashboard, we have really jumped over the weekend, which was expected because of community-wide transmission, unfortunately, to 259 cases that are confirmed. 59 of those individuals have recovered and are no longer on isolation. Unfortunately, another death was experienced with a patient who was hospitalized. We have 664 people in mandatory quarantine. Just a caveat that not everybody who is in mandatory quarantine has been tested, but they're in direct exposure of a confirmed case. So they need to be on quarantine and isolate themselves in order to prevent further transmission. We have, as of Friday, we had 180 negative test results for a total of over 438 negative results. So that is good, and we'll continue to update those numbers as they come in. I do want to say that we continue to monitor the number of people hospitalized for COVID-19, and we're monitoring that very closely. I believe about 19 people are in the hospital currently who have been tested for COVID-19, and there are an additional number of people in the double digits whose test results are pending. So this is very serious, and this is why we want to talk more about community transmission and prevention of this novel coronavirus. I want to mention briefly the recent recommendation that Public Health and Sullivan County is supporting from the Centers for Disease Control for the public to follow their newly announced recommendations for wearing cloth masks while in public if you have to go out and it's essential to get groceries, gas, medicine at the pharmacy. Please limit your movements to these essential trips if you're not an essential worker, and those who are essential workers out in the public, interacting with the public, please wear masks if you have them available. You can easily make them. I know there's a number of community groups who have offered to make them. There is actually a tutorial on the CDC website for how to make them without sewing, so you can easily do this in many different ways. The reason why we're now recommending wearing cloth face masks in public if you have to go out, and again, you should be staying home as much as possible, is because of the new research coming out that indicates that people may be able to transmit this virus before they are symptomatic, up to 1 to 2 days or more, before they start to feel sick. So this is part of the reason why community transmission continues to happen, and we want to do everything we possibly can to limit that. If someone is wearing a mask in public, it does not mean they are sick. It means they are doing their part to prevent coughing, sneezing, breathing in the same space as other people to limit community transmission. So again, the route of transmission continues to be the same, from droplets and from touching surfaces and then touching your face. So please avoid touching your face, even if you are wearing a mask. All this information is on our website, on our social media page, and on the CDC website. And we continue to remind people that this does not mean you should be wearing an N95 mask or a surgical mask. Those are in short supply. They continue to be both in our county and statewide. And those are reserved for healthcare workers who are taking care of patients in the hospital, nursing homes, and other areas in terms of direct patient care. So please use the face masks that you can make at home through various types of cloth. And there's a lot of information online. And finally, before we go on, I just want to let everyone know that April 6th through April 12th is National Public Health Week. And I want to really take this moment to thank my staff and all of our county workers who are assisting the Public Health Department with this outbreak. Never before in our lifetimes have we had to respond to a pandemic of this size and nature. And I just really know that everybody is working so hard, incredibly hard, 24/7, to support our efforts to keep everybody as healthy and safe as possible. So thank you to everyone, and especially to our public health staff.
Thank you, Nancy, for that. Our next question goes to Josh. The Fallsburg supervisor is trying to get the New York State Health Department to sign off on suspending the operation of bungalow colonies and other seasonal residences in the town. Since other Sullivan County towns have these residences as well, what is Sullivan County doing about this?
Thanks, Mike. I think it's important to reiterate kind of the broad response to this pandemic has been controlled by New York State through the governor's office. So in typical emergencies such as floods, counties, towns, villages have a lot of autonomy in how they respond to those types of emergencies. Obviously, with this being such a widespread issue affecting every community across the state, the governor has basically taken control and not allowed local governments to respond without his approval. So what Steve Vegliante was attempting to do was something that a lot of our towns are concerned about is a swell in population, whether they're primary residences, bungalows, or camps. So Steve had attempted to kind of put in an executive order to limit the opening of those facilities. That was denied by New York State. And we've seen denials of similar requests in Orange, Ulster, and Westchester counties as well. So we're actively looking at alternatives, whether they be public health orders or other executive orders the state may consider. What the public should understand is typically permits aren't issued for these types of facilities until the end of the month of April anyway, so you shouldn't be seeing a lot of activity in the next several weeks, but this is something that we are actively working on with the state, other counties, and healthcare facilities to try to avoid that large swelling population to overwhelm our hospitals.
Thank you, Josh. Next question is for Nancy. The answers given in past town halls seem to indicate the county is waiting for state and federal guidance as opposed to proactively advocating for our testing and supply needs. Now Governor Cuomo wants to confiscate supplies and equipment in upstate New York. What's your plan when he takes our inventory and we need what he has taken?
So I want to be very clear that as a county government, we have been advocating for the needs of Sullivan County residents from the very beginning regarding supplies and testing and equipment, and we've done a very good job of ensuring that we have as much PPE and availability of equipment as we need currently, and we will continue to do so. I also want to remind everybody that test kits and supplies are not just a local issue, it's a state, federal, and global problem as well. So our current caseload and increase in numbers over the last 6 days indicates a jump of at least an average of 20 cases, new cases per day. Now that shows that community transmission is on the upswing, which we have predicted and we will continue to see unless we make sure that everybody is doing their part to stay home as much as possible and to limit gathering in groups and to limit their movement throughout the community. That is the best thing that we can do and continue to reinforce. It's not our belief that the governor will confiscate Sullivan County's small amount of available supplies in comparison to other counties and other parts of the state and what's happening currently. But we're watching this decision closely and we're developing options to enable Sullivan County residents to obtain the necessary medical care that they need if and when they contract COVID-19.
Thank you, Nancy. I'm going to address this next question. What should I do if I see people breaking social distancing rules through large gatherings? I'm going to read to you from the governor's office. He gave guidance on this issue. To assist local authorities with enforcement of these orders, the governor established the New York State Pause Enforcement Assistance Task Force, where individuals can file complaints regarding the operation of non-essential businesses or gatherings 24 hours a day, 7 days a week, through an online form or by calling 1-833-789-0470. Once again, that telephone number is 1-833-789-0470. As well as that, We also ask that you, another avenue is just calling your local police department or the sheriff's department. Next question will be for Josh. What happens when we're unable to pay our water and sewer bills or our electric bills? Are we not going to have water or be able to go to the bathroom or not have any electricity? I am very scared for my family and others on what to do. Please let us know. Please let us all know what can be done. The stress is overwhelming to my family and I'm sure to many, many people.
Well, in terms of electric, NYSEG and Orange and Rockland are prohibited from turning off power due to non-payment. That was an executive order of New York State to the Public Service Commission. We're unaware of any municipality that's going to take action to turn off water or sewer services due to an unpaid bill. Obviously, if you have specific questions, you should contact your local town or village municipality. But I think importantly, if someone's having trouble paying any type of bills, I think there's obviously some very substantial federal stimulus bills looking to address people being out of work. So you should really either contact our Emergency Communication Assistance Center or the My Benefits page for some of the social services needs. There's a litany of different programs, whether you're self-employed or lost a job through an employer, to be able to help you through this trying time.
Thank you, Josh. Our next question will go to Nancy. The number of COVID-19 cases is rapidly spreading throughout places housing individuals in confined close quarters, such as within the jail and prison system. In response to this, the state has reversed its initial decision to not allow masks to be worn while working. Will Sullivan County allow or mandate that its corrections employees wear protective equipment, such as masks, to help protect the workforce as well as the offenders?
So earlier in the week, last week, I believe the sheriff addressed some of the questions that come up about what was happening in the jail. He is not here today, so I will just go over what I'm familiar with. The county jail has a plan and is currently isolating anybody who comes in who's sick, who has any symptoms of fever, cough, or shortness of breath, in a separate area in the jail from the rest of the inmates. The corrections officers and any sick individuals, inmates in the jail, do have personal protective equipment that the Office of Emergency Management has provided to them, and we will continue to do that. Employees and inmates are screened on a daily basis to ensure the best is being done for everyone's health and safety. We're not in a position to address what's being done in the state prison system, but that's what we currently have in terms of protocols in the county jail.
Thank you, Nancy. Next question goes to you as well. How do residents in need of public assistance apply? How is the process going now with interviews, and what do we need to do? This includes WIC. This is an emergency situation with people needing public assistance. Or will we be homeless? Yes.
So there's a number of resources available to community members through a variety of departments. And rather than going through each one of them separately, I will just give you a couple of phone numbers and a website. The Department of Family Services in Sullivan County administers the public assistance and Medicaid programs and food stamps. And so anyone needing to obtain benefits through the Department of Family Services needs to call 292-0100. And you can be assisted. Many of the employees are working by phone, trying to limit the number of people coming into the lobby at any one time. There's also online applications through mybenefits.ny.gov, and you can look and apply online through the State Health Department and selecting your county of residence and complete your applications that way. The WIC program continues to operate by phone. Appointments are by phone. No in-person appointments are being held at this time. We do have staff at the Government Center for the Monticello Clinic by phone, as well as in Liberty. So we've split the staff into two separate locations, and anybody who needs an appointment can get one, and everything will be conducted over the phone, and documents will be, there's a process for handling proof of income and whatnot. That number directly is 845-513-2235, and again, you can also call Public Health at 292-5910. All other inquiries regarding anybody needing assistance in any way with food, medication, benefits, unemployment, and how to apply and how to get help can call our Emergency Community Assistance Center 807-0925, and they have callers who will help give you the information you need in order to take care of your families.
Thank you, Nancy. And our last question is also for you, Nancy. This is a repeat question, so please share again, Nancy, what your department recommends. What can the county do to ensure private businesses are having employees and customers follow social distancing rules?
So stores are private businesses, and as such, we really can't mandate what they can and can't do. However, we are here to provide guidance and recommendations and best practices, and we've done that, and we'll continue to reach out to them. We've worked with the towns, some of the town supervisors, who have fielded questions from residents about some concerns about too many people in various stores, no social distancing over the last week or so. So we have worked with the Sullivan County Visitors Association and the Chamber, and from time to time we've reached out from the Emergency Operations Center directly to these businesses and stores and have given them information and guidance on things that they can do that are practical to limit the number of people coming in at any one given time. Also to make sure that people are 6 feet apart or more when they come up to the cash register, going up and down the grocery store aisles, that they have signage that reminds people of the need to do this, and also hygiene practices. So we'll continue to do that and reach out to them, and we'll be doing more in terms of public messaging.
Thank you, Nancy. Now, before we leave you for today, I'd like to express my thanks again on behalf of the Sullivan County Legislature to Robert Tafour. Thank you for joining us and sharing your thoughts and what the public school system is doing right now. Thank you very much. As well as Nancy and Josh, both, thank you for what the two of you are doing. It's been phenomenal. Thank you. You know, this weekend, my wife came to me, and as I had mentioned a few meetings ago, that some of our legislators have unfortunately been involved in medical procedures. And when I was in the hospital, my wife had a friend who happened to work in the hospital come up and say hello, and I had never met her before, and she was pleasant and enjoyed the visit. But I learned over the weekend that her brother, who I did not know, passed away from COVID. And he was my age and had apparently no underlying conditions. And his sister shared that he passed quick and alone. So this just underscores the importance of what we're going through now. And we can never be 100% sure of anything we're doing is right. There isn't a book on this. But it's up to us. We're in a free society, I've mentioned this over and over again, to make the right decisions and be responsible in those decisions. This is so very important. For me, even though I did not know this person, it was close enough and I could relate, and it really made me stop and think. I just wanted to share that because that just underscores what we're all going through, and I'm sure others, unfortunately, have similar experiences. And before we sign off today, I'd like to share with you a few thoughts. One of the areas of responsibility we have as legislators through the county manager's office is to oversee the functioning of the county. It is from this perspective that I, on behalf of the Sullivan County Legislature, say thank you. Thank you to the county workers. Throughout this trying time, in service to our county, your performance has been exceptional, each and every one of you. So thanks from the bottom of our hearts. Thank you for continuing your work and to provide the level of service that the residents of the county appreciate and respect. With that, I'd say have a good afternoon, stay safe, and bye for now.